All right, Dr. Emer, you're live.
Alright guys, it's Dr. Emer. How are you? We're in West Hollywood, and I have one of my beautiful long-term patients who I love to see, but she has this annoying condition that everybody knows of as rosacea, or at least some flushing and some redness on her skin that really starts to bother her. We've been being aggressive with getting treatment done to improve her skin, and we're doing right now what's called a pulse dye laser treatment, or the Vbeam. Now this laser has been tried and true laser, the main gold standard treatment for rosacea for many, many years, because as you can see, it's literally targeting the blood vessels. And even though rosacea can come and go, we need to shrink those blood vessels to keep her symptoms at bay so she doesn't get long-term dilated blood vessels or pain in these areas. So we're really focusing on all her problem areas of where the rosacea is. Now, in more recent past, we've figured out that, in recent history, turn to the right a little bit, we have figured out, we're going to start on this side, 1, 2, 3, we've figured out that combining this with non-ablative lasers, light ones, like Clear and Brilliant, or superficial radiofrequency nanofractional RF, such as the Venus Viva, is very useful for people that have long-term redness on their skin, because inflammation goes down when these energies work on the blood vessels. And it's a little shocking, but is it painful or no?
No.
What does it feel like?
You know, it's not even a rubber band.
I know, it's like a spritz.
It's a spritz, yeah.
It's like a flick. I don't know how to describe it. It's a flick or a spritz.
Yeah.
But we're focusing on all the areas she has redness, including, I'm going to do your nose now.
Yes.
Including her nose.
It's gotten really bad lately.
I'm going to help her. I'm going to help her right now.
What's the laser called again?
This one's called the Vbeam. And you guys can see, if you look over there, there's the Vbeam Prima, which is the newest Vbeam that we're using on the market for rosacea. Now I'm going to focus a little on your forehead too, okay? Hold still. Rosacea is one of those things, guys, that can have symptoms, and there's all different types of rosacea. Fighting this rosacea is when people have like very large dilated noses and big, thick skin. We try and avoid that from occurring by using this lasers earlier on when people notice it. But there's also acne type rosacea, where people have pustule, we call it PP or papulopustular rosacea, which looks like acne. So it's really important, if you do have redness and bumps, you come in and get that treated, because sometimes that needs Accutane or very aggressive skin care. For this type of rosacea, which is called the ET type, or erythematotelangiectatic type, this is where we focus on really treating inflammation. Blood vessels that are dilated plus redness on the skin. So I'm gonna show you guys 1 second. We're gonna switch the setting, because we focused on the diffuse areas. Now I'm gonna switch the settings really quickly to treat the actual dilated small blood vessels. So hold on 1 second.
Is this treatment available in New York?
Yes. Whenever I'm in New York, we can do this treatment too. There's also a newer laser that's a competitor called the XLV that also can be used as well. So now we're going to focus on treating some of her blood vessels. So we're recalibrating the system, and she's saying that her nose was really bothering her, where these blood vessels are dilated. Let me show you guys. You can see. If you look here, you see like right there's a dilated blood vessel right over here, on the corners of her nose over there, top of the nose right here, and actually a lot of them cleared with that first treatment, that first pass. So now, I got those. That's good. We're going to focus on, now this is cool. I'm going to show you guys. And take a look. It looks like a UFO. See? It's like a UFO. I always tell people that. So I'm going to test it on my arm. 1, 2, 3. Pulse. Perfect. Because this is in the shape of where the blood vessels are, on the little wormy shape, so that we can get those blood vessels turned a little to the right, a little more targeted. and it allows them to disappear a little bit more easily because the energy is very focused and linear rather than a circular pattern. So we're going to focus on those small babies.
How
Vessels. Yep.
how often would you suggest this treatment?
Well, here's the thing. When you have it very severe and flared, you need to do treatments every 3 to 6 weeks for about 2 or 3 times. Then we need to maintain at least every quarter is what I would tell people, unless it continues to flare. But this should calm it down for her very quickly. We haven't really actually done a full treatment probably since November. So that's a very long time. That's why it's a little more flared now, and we're being a little more aggressive with treatment. So we're targeting, turn all the way left a little bit. I'm going to cover you a little more. Keep your eyes closed. Good. We're going to go into that little crevice here and get some of these blood vessels. Good. So no, you're doing great. You're targeting some of the smaller vessels that she has.
And what would the downtime look like?
Well, the downtime from this isn't really much. It's just a little bit of redness today, and then it slowly starts to fade over the next few days. You guys, what's important is this isn't an ablative laser. This is a focused targeted vascular laser. What that means is all you're going to see is redness, but nothing on the surface that's going to harm her. Perfect. Okay, good. So that is the Vbeam treatment for rosacea. We're going to go into the second component in a second.